Let's take some time to talk about blepharoplasty, or eyelid lift surgery. It's essentially a surgery where we're removing excess skin from above the eye or from below the eye in order to improve and rejuvenate the shape of the eye and the feeling of your eyes. Many patients come to me because they feel like they look older in photographs or they feel heavy in their eyes. It's really important to understand that excess skin on the upper lid can actually contribute to a feeling of tiredness or heaviness to your eyes over time. Blepharoplasty is a surgery that requires removing skin but also dealing with the fat and soft tissues below. It's not a simple surgery, although it is a relatively short surgical procedure, and upper blepharoplasty can be performed under local anesthesia. I would never say that it's a simple surgery. It requires an important understanding of the functional aspects of the lid and the aspects of healing over time. So with regards to upper blepharoplasty, one key concept is not over-hollowing the eyelid above. Many times you see surgical procedures where a lot of excess fat has been removed from the upper eyelid. In my practice, I like to take the fat, especially fat that's in a compartment that's just by the nose, and redrape it to add a uniform fullness to the upper lid. I also want to create a uniform tarsal crease or uniform show of the skin just above the eyelashes so that things look even across the entire upper lid. This approach is called fat repositioning and really allows us to have a dynamic control over the skin by removing some of the skin that's there, as well as the deeper components to the eyelid. And oftentimes I'll combine that with minor fat grafting to the brow or to the lateral temporal region in order to improve the overall aesthetic of the eye. The lower lid is just as important and is very important to consider when you're doing an upper eyelid surgery. If there's heaviness that's in the lower lids, like bags in the lower eyes, we can address that by, again, repositioning that fat that's inside, the intraocular fat, repositioning it over the cheek lid margin to give a soft and even result in the lower lid as well. Usually when I couple these two procedures or do them at the same time, we're also doing procedures to help prevent dry eye at the same time, doing a suture at the lateral aspect of the eyelid to help keep it from being dry, and maybe even addressing the location of the lateral aspect of the eye to make sure that you have an upward tilt or a slight upward tilt to improve the overall aesthetic of the eye. It sounds complicated, and it really is. Blepharoplasty is not an easy surgery to do. It's definitely a complicated surgery that needs to be done right. And that's my approach to blepharoplasty surgery. I look at every patient as an individual and say, how are we going to address not just the skin, but also, if needed, the muscles, if there's a droopiness to the eye, if needed, the fat compartment, and all the other aspects around the eyelid to improve the entire eye, not just deal with the skin that's there, but do full peri-orbital rejuvenation.